Welcome to my BioBits video. In this video, I will be talking about the newly approved epilepsy drugs and therapies that will benefit those affected by epilepsy. To start things off, I would like to do a brief overview of epilepsy. Epilepsy is a neurological disorder in which nerve cell activity in the brain is disturbed, which causes seizures. During a seizure, a person will experience abnormal behavior, symptoms, and sensations, including a loss of consciousness sometimes. Seizures are bursts of electrical activity in the brain that temporarily affect how it works. They can cause a wide range of symptoms. Epilepsy can start at any age, but usually starts either in childhood or in people over the age of 60. It's often lifelong, but can sometimes get slowly better over time. Epilepsy is one of the most common neurological disorders. There are more than 200,000 reported cases in the U.S. every year. There is no cure for epilepsy. However, early detection can have a big impact in controlling the condition. Causes of epilepsy. Doctors are still not fully aware of the causes of epilepsy. It is possible it could be partly caused by genes affecting how your brain works, as around 1 in 3 people with epilepsy have a family member with it. Epilepsy can be caused by damage to the brain, such as damage from a stroke, brain tumor, severe head injury, drug and alcohol abuse, brain infection, or a lack of oxygen during birth. New treatments. Each individual battling epilepsy responds to treatments differently. The newly approved drugs and therapies provide an additional needed treatment option. The CBD therapy, cannabis oil, was the first FDA-approved medication derived from marijuana. This treatment was approved in July 2018 for seizures associated with tuberous sclerosis complex. The therapy was approved in 2018 to treat seizures related to 2 other rare conditions, Lennox-Gastaut syndrome and Dravet syndrome. In November 2019, the FDA approved a new drug called Xcopri to treat partial onset seizures in adults. Studies were performed with this drug to see how effective it is. Gregory Cross, a professor of neurology at Johns Hopkins University, who was a co-investigator for the drug's clinical trials, said that in 2 placebo-controlled regulatory trials, about 60% had marked seizure reduction and 20% became seizure-free. In January 2020, the FDA approved a diazepam nasal spray called Valtoco, which is used to treat periods of frequent seizures. Valtoco is a rescue medication approved for the acute treatment of seizure clusters. Rescue nasal sprays can be life-changing for families who fear leaving far from home because their child might have seizures and not be near a hospital. These treatments can change the quality of life for these families. The future of epilepsy. Dr. French, the Chief Medical Officer for the Epilepsy Foundation, explains the growing procedures for epileptic patients with her quote stating, "The pipeline for epilepsy therapies is just exploding, which is a wonderful thing to see. There is a renewed enthusiasm for tackling the unmet needs in epilepsy." Epilepsy therapies are improving as more research and studies are being performed to help patients. Dr. French explains that most therapies up to now have been symptomatic treatments. They can stop seizures, but they leave the disease unchanged. However, emergent therapies are likely to include disease-modifying drugs to address the genetic component of this disease. Advances in epilepsy treatment are occurring at a rapid pace, benefiting the lives of families across the world. Thank you for watching.